Hello and welcome to the Personalised Care Institute Application Process webinar. I'm Kevin Barrett, I'm one of the clinical leads of the process, and today we're going to talk you through the process of applying for accreditation, what it means, and some of the pitfalls, and perhaps some hints and tips to make the process smoother for everybody. So today we're going to talk about the accreditation process, the governance behind it as well, a bit of background about the Personalised Care Institute, the application form itself, the stages of the application, and then questions afterwards. If you've got a copy of the application form in front of you, it'd be useful to have this because we're going to go through this. We're going to share some bits on the screen, so don't worry too much if you haven't got one, but it might be useful to have it in front of you if you have it available. So for those who haven't looked at the Personalised Care Institute website or aren't familiar with it, the Personalised Care Institute is a virtual organisation that is accountable for setting standards for evidence-based training that's underpinned by a robust quality assurance and accreditation framework. NHS England set up the Personalised Care Institute, and they've appointed the Royal College of General Practitioners to be the convener of the Institute. And we're working with the other Royal Colleges and key professional organisations, providers and patients to develop the Institute. The RCGP are in charge of the accreditation of the work that comes through. Accreditation is an independent validation of the quality of the programme of learning, and it ensures that healthcare practitioners, both in social care and healthcare, and commissioners as well, can easily access high quality training in personalised care. The three parts of this are the curriculum, which is available on the website. If you go to the personalisedcareinstitute.org.uk website and scroll down to the very bottom, there's a link to the up-to-date version of the curriculum on there as well. We're also responsible for training standards, and the two together give us the PCI accreditation, which we're talking about today. So the process for accreditation is a three-stage quality assurance process. The full process is expected to take 3 to 4 weeks, and that's from the time at which we've formally accepted all the information, the paperwork, and made sure we've got a complete access to the documents and a completed application form. It's not 3 to 4 weeks from the date that you might submit the application form. It's from the date that we've confirmed that actually the application form and the documentation we've received is appropriate. Then we'll talk about the process a little bit later on. Once you've been accredited though, the programme will be listed on the PCI website, and you can use the PCI accredited logo on the programme material and the marketing collateral that goes with it. And that's to ensure that we have the same imaging and the same branding, and everybody knows that when they go to an event, it's been accredited, it will meet the gold standard and meets the standards that we need for personalised care for you. Accreditation is based on a 3-year cycle. So first application is a little bit more complicated. That's the bit we're going to talk through in the main today. At the end of the first year, we'll require you to submit an annual review form, which will include details of the activity that you've done over the 12 months, feedback forms, any updates that you've made, any changes or details of any quality assurance process that have gone through, plus any changes to the team producing the material and the team providing it. So it'll be a much shorter process that will develop. And then we'll do that twice. And at the end of the third year, we have to start afresh with a new application. Although for most people, actually, it will just be resubmitting an updated version of their original application with relevant tweaks, changes to material, those sorts of things. So it won't be quite as onerous as doing it the very first time. And then there'll be a smaller charge for that year 2 and that year 3 before it goes around again as well. So that's what to expect from us. If we discover in between the initial accreditation and the first year and the second year's stop checkpoints, that things perhaps aren't going to plan. So if the material's changed, if the providers, the delivery, the content, the material if the standards have dropped, and we get both formal and informal feedback from those attending the course and others involved, we can always go back and actually ask you for confirmation of the details, what maybe the problem might be, and if it's resolvable, that's absolutely fine. We may actually also send an assessor along to sit in on one of the events as well. We've done that once or twice in the past, and that's been a very useful exercise, just to provide that level of quality assurance, so that everybody's assured that what we're providing, what we're giving to people, meets those high quality standards. So when we look at the courses, there are 4 aspects of the course that we look for. We look for the initial course design, which is the key part of it. So what the content is, the agenda, how it's been produced, the quality assurance, the internal processes that have gone towards producing the material. With personalised care, the delivery is probably equally important. We know that the theory behind it has been around for a while. It's been called different things. But the delivery is the bit we're really after, and that's hard. That can be hard for us to assess because we've only got a very 2-dimensional report that comes to us. But we want to know that the people involved in delivering that course have got the experience and the qualifications and the expertise to deliver a high-quality course. The monitoring and evaluation, again, is a key part of this. We need to make sure that actually we're getting the feedback that you are delivering the courses, that the people attending the courses are gaining from them, and they're happy with it as well. Sustainability, again, is a key factor. And again, what we're after with that is actually almost not quite train the trainer, but a way of actually ensuring that the material, the content that's being delivered can be shared, that people that are working in teams can actually use those bits to upskill the rest of their team, not necessarily in a formal way, but to deliver that and spread the word about personalised care and what it means, and make sure it's delivered in practice to a wider community. Sustainability also means about making sure that the organisation can deliver this at scale. Personalised care, it should be an England-wide means of delivering the upskilling, the training. It's slightly easier these days within the days of COVID because we're doing a lot more work virtually. But at some point when we get back to doing face-to-face work, we need to make sure that the organisations have got the capability to deliver that at scale across England, if not the rest of the UK, but we're particularly focused on England with this. So a little bit more detail. Course design, we talked about the curriculum before. Again, that's available on the website, 80-page document broken down into the key areas with the 3 different levels involved, and 4 of the 6 areas that we're particularly looking at when it comes to personalised care. It's evidence-based, it's up-to-date, and it incorporates the perspective of lived experience. Those of us who are clinicians that are involved with speaking to people on a day-to-day basis know just how important it is to actually translate the theory into practice. Resources, again, evidence for achievement. Again, this is not just about us delivering a very, very flat, boring, didactic teaching style, which this webinar is ending up being like that. We want it to be interactive and make sure that people are actually learning and gaining and have all sorts of different learning experiences to make it a proper experiential one. And there's all sorts of different things we'll be looking for within that. Things like a pre-course assessment of learning needs, interactivity within the courses, so some small group work or using the various bits of IT that you can do online these days, case studies, role play, thinking time, space for people to write down their thoughts as they go along, all those sorts of things that actually make a day of learning into something memorable that really changes people's behaviour, so they can help those people that they interact with when they go back to their day jobs as well. And again, we need to make sure it's focused to that defined group of learners, whether they are GPs, healthcare assistants, practice nurses, social workers, occupational therapists, link workers, social prescribers, whoever it might be. We need to make sure it's targeted to their prior level of knowledge, their professional background, and what they're aiming to achieve out of it. So a bit of a juggling act, but it becomes clear on the application form. And again, delivery, just to echo what I said before, the same things. It needs to be practical, experiential learning, challenging, but in a safe way, with lots of opportunity for self-assessment and feedback in particular. For those that have done any educational theory will know that giving good feedback is a key part to delivering a high quality interactive experience. Formative assessment, again, formative assessment rather than a simple set of MCQs at the end of multiple choice questions at the end of the course is key to really get people to think. So these are sorts of things that we're after from the course delivery as well as the course content. And again, because it's an NHS England funded project, they want to have all sorts of information and data fed back. There are some standardised forms that we'll tell you about once you've submitted and as part of the post-accreditation process. But it has to have attendance data, attrition data, completion data within it, feedback forms. There's a standardized online feedback form that the Personalised Care Institute will use to gather feedback about the courses as well. And again, these days, we need to think about making these courses accessible and inclusive to all learners from all backgrounds. So that's a key part of it as well. And then sustainability, cascaded model, local champions and leaders, and then financial viability for future developments. Those are all key parts of it, as we talked about before, just to make sure that the learning is not just a one-off event, and that the organisation providing the learning can provide it at scale, and have both the organisational and the educational sustainability to deliver it. So that's the theory, which hopefully most of you will know, but I appreciate there are providers with varying levels of experience who'll be watching this. Those that have been through the accreditation process before will be kind of hopefully know all of this, but those of you, if you're doing this for the first time, this is probably the important part of the form of the webinar, just to go through the form. So the way to apply for accreditation, go onto the website again, personalisedcareinstitute.org.uk, have a look through that, and then make an inquiry. There's a link at the bottom to start the process going, and then we'll send you all the information that you need together with a copy of the application form. And those images on the screen there are what are two of the three things that appear at the bottom of the website on the Personalised Care Institute website. So accreditation, that's what we're really here to talk about. There are a number of things that we look for when we're accrediting organisations and bits of work. So we need to make sure that they are in accordance with and promote the values of the Personalised Care Institute and the NHS Constitution. And those are very simple things about fairness and equality, inclusivity, and just making sure that actually we are delivering a project that's fit for the times that we live in. Again, ethical professional behaviour towards colleagues is really important. We know that we can't have anything that has anything that might shame a particular group or have any bullying. Those standard things that we should all have in our own organisational documentation, and actually become part of what we live and breathe these days. And finally, we need to promote high quality, evidence-based, cost-effective training in personalised care that facilitates behaviour change. So again, behaviour change is the key with this. So that's the background to the accreditation. This is listed on the application form for you. So hopefully as you go through it and read the application form, this will become clear. Again, we talked about professional standards. So those involved with education in the past know that there are a set of Academy of Medical Educators and other organisations that have a clear set of standards for medical education. If you're not familiar with those, not looked at those, it's worth having a look at. Their websites are again available, and there's lots of useful information on there that can help. If you're an organisation that's already established and delivering education over a wide variety of arenas, these things actually, even if you're not familiar with them, they'll actually be very similar to what you're doing already. And again, we talked about tailoring it and innovation. Now, innovation is interesting. What we're not saying is that we want every provider to deliver things in exactly the same way. What we want you to do is to actually think about different ways of delivering things, try different ways, different methods, look at the educational theory, see what works, use different bits of technology. The NHS is evolving, and technology is evolving, and health and social care systems are evolving at such a rapid pace at the moment because of COVID, that people are doing things in all sorts of different ways. And if you see something that you like, you think, yes, I'd like to try that. We're very open to that. We're not saying that you have to do things in a very, very structured, rigid kind of manner. So be brave and please experiment with things. So the application form. I've highlighted some particular areas that have caused problems or caused issues when we did the pilot application. So I thought it would be worth going through some of those in some detail. The part above this on the form is the straightforward things, putting your own details down, contact details on here as well. So 1.8, 1.9, 1.8 type of organisation. Is it a private organisation? Is it an NHS trust? Is it a charity? That's really what we're after on here. The nature of the business, how long you've been running for, your background, experience in delivering personalised care, that's really what we're after. If you don't have any experience in directly in delivering education for personalised care, that doesn't matter too much. What we want to know is that you've got a background and some experience in delivering education along those sorts of lines to a wide range of professionals. We're expecting applications from organisations that are national, with hundreds of employees working away doing these sorts of things, but we're also supportive of applications from smaller organisations. So those ones, people working from home, just with a small team of 1 or 2 people, that's absolutely fine. We're not saying that you have to be a large, major international body to apply for this. If you've got any accreditation, then it's useful for us to know that, because that does help us support that. But again, that's not essential. And again, the last part, 1.10. So for those that are not familiar with the acronyms on there, ICS and STP. So ICS is an integrated care system, and STP is a sustainability and transformation partnership footprint. So with STPs, I think there are currently 44 STPs across England, and these are groups of clinical commissioning groups that have come together as a larger organisation, covering a population of sort of between 1 and 2 million population on average. So that's the sort of scale we're looking at for delivering these sorts of things. Again, it's not set in stone. Happy to look at things that reach a national audience all at once, or even some very, very localized targeted events. Again, it's just an idea that we need to make sure this is accessible to everybody throughout all of England. Just a pointer as well about the application form. When we look at the application forms, what we're really after are answers that are neat, to the point. What we don't want are paragraphs and paragraphs and paragraphs of things explaining background. We just want some simple, straightforward bullet points that evidence what you've stated. Again, with 1 or 2 word answers, a single sentence isn't enough. Probably several bullet points or a paragraph or two is really what we're after on the application form, just to make it very, very clear to us. We have a wide range of people involved in the assessment process with different backgrounds. So again, trying to avoid acronyms and trying to be very clear about the evidence. And I keep saying the word evidence, but that's really important for us. We need to kind of show that you're demonstrating that you can deliver what you have said you can deliver. The nominated professional, that's another thing that did cause a bit of a discussion when we did the pilot applications. The nominated professional is usually somebody within your own organisation that has some kind of professional registration. Now, it doesn't have to be somebody that's directly involved with the process. If you don't have anybody within your own organisation, then you have to look outside to find somebody. Again, it can be a doctor, a nurse, social worker, anyone with a sort of professional body behind them, like the GMC or the Nursing Midwifery Council, those sorts of organisations within it. We're not saying that they have to be accountable for what's being delivered, and we're not saying that they are putting their registration at risk by being the nominated professional. So that's not what we're saying by this. What we want to know is that there's been at least one other person that's had a really good look through this and is happy with the content. So it's another internal checkpoint for us. What we don't want is an application that's just been written by one person who's not shared it with anybody else, that's not had that peer review, and by having this nominated professional that ensures that actually, at least 2 pairs of eyes, hopefully more, have seen it, and that we have got somebody who's happy to support it. So again, just when you're finding your nominated professional, just make sure that they're happy with the content, happy with what's been submitted, but they're not putting their livelihood on the line by having their name on here. It's just another checkpoint for us. We don't necessarily expect to contact them. As far as I remember, we've never contacted them in any of the other accreditation work that we've done. We've never had cause to. So it's unlikely that we will contact them and grill them about the application. It's just to make sure that another pair of eyes has seen it and they're happy. The accreditation process is a multi-level, multi-stage process, so this just adds another level into it. So come on to sponsorship on here as well. So again, sponsorship product endorsement is probably not as much of an issue for personalised care as it would be for other aspects. What we don't want to see is any obvious branding, any, I'm trying to think of examples. If you put in, you know, you're talking about physical activity, what we don't want to see is a particular sports brand with their logo emblazoned all over it on screen. Again, because the thinking behind that is obviously that the RCGP need to stay independent and meet the ABPI guidance for sponsorship. The current version of the sponsorship guidance that was published in January 19 is on the RCG website, but the relevant paragraph from there is 6.1, which is basically the RCGP, and therefore the Personalised Care Institute do not endorse individual products, treatments, or medical devices of whatever kind, because we believe the patients or the clients we're talking to need the widest possible range of treatment options. So again, just double check that. Some things, if we talk about medication, then on the whole, where it's appropriate, use a generic title rather than a brand name. It's probably, again, not going to be an issue with this. But again, if you're looking at particular websites, what we don't want to see are websites or apps or books where you're sort of seen to be endorsing or promoting one particular product over another. We do have a slight issue with people recommending books for people to read. Again, books on the whole are not peer reviewed, and we're always slightly concerned about the conflict of interest and what's contained within the book. So we'd rather not have any books recommended within this. Medical apps, again, we're trying to ensure that any apps that we recommend have been through an endorsement process. There is an NHS app library available. There's not very much on there in terms of sort of personalised care, behaviour change, but it's expanding all the time. So if there's a particular app that you like, that you recommend, then if at all possible, try and use one that's been on the NHS app library. If you do want to recommend a particular book or particular product, then we may be able to allow that. It depends in the manner in which it's being used and promoted. So again, any queries about those sorts of things, please let us know beforehand. But we need to be seen to be as free from any endorsement wherever we can, because we just don't want to kind of get involved in disputes with competitors and to be seen to be an organisation that goes down that route. We need to be as independent as we possibly can be with those things. So the other bit that I think is interesting is the curriculum. I've mentioned it a couple of times already, and that's because it's a key document within this. The curriculum talks about our core capabilities, the models and approaches, and the 6 components that we're looking for. The application form on there discusses which of the components the material is mapped to. This is very good, very, very important that we have it very clearly stated which of those areas that we're mapping to. If you're delivering content that covers a number of different areas, it becomes a little bit harder. But what we don't want to do is just everyone to list every single thing that's on this page on every application, because then it makes it harder for us to actually specify what's going on. Usually when you produce an event or some learning materials, it will be focused towards one of those areas, whether it's personalised care planning or supported self-management. So have that as the main area that you're after, and then you can list the models and approaches that you might be using within that. Again, the language of personalised care is really important. We know that personalised care has been ongoing in various forms over at least the last 20 to 25 years, but it's been called all sorts of different things. What we're trying to do with the Personalised Care Institute is make sure that the language everybody's using is consistent, and everybody knows when people say a particular word or a particular phrase that they mean the same thing. So if you're a provider that's been used to providing content but using slightly different language, what we'd really like you to do is to be able to sort of translate and transfer the language into the language used by the curriculum as far as possible, because that will actually help everyone's consistency when it comes to talking about the personalised care education training they've received. So again, just going through the curriculum again, we've got different levels on here. We've got level 1 and level 2, which are core capabilities, and then again, lots of applications will focus on that. And then we've got the 6 components, which are sort of level 3 based things as well. The curriculum itself breaks down the components and says what's required for different levels, where it's appropriate within that. And the assessors, when they look at it, they'll be mapping what you've submitted to that area of the curriculum. So again, to make everyone's lives easier and to make the process as smooth as possible, please be very clear about what which bit of the curriculum it maps to. I know this is new, it's going to take a while for people to get used to it, but hopefully, you know, as we start working on these things and producing the material, it'll become a bit easier, and we'll all become more used to it, and the language and the mapping will become more straightforward. Again, learning outcomes, again, this is on here, again, this is an important thing. What we're after on here is just a few key bullet points. Again, we don't need paragraphs and paragraphs and paragraphs of things written, but we don't just need a couple of words. What we want is some very clear bullet points, learning outcomes. I expect by the end of the course, the learners will be able to do X, Y, and Z, and this is how it's going to be achieved. And then we'll talk about the actual how that's going to be delivered in that bottom box in 4.6. So how they're going to be active participants in the learning event. So again, exactly what we talked about earlier on as well. And again, the top at the target audience, that definitely helps us to know who this audience is aimed at. If it's aimed at a wider range, that's absolutely fine. If it's very specifically targeted towards a particular professional group, again, that's absolutely fine. But we just need to have that clearly stated on there as well. And again, we talked again about evidence and claims and bias, and again that fits back to the to some of that to the bit we talked about before about the RCGP, making sure that people it's free of bias on there too. Evidence again, this is more we've taken this from the continuing professional development application process on here. So we have a hierarchy of evidence. So if you are quoting evidence, really want it to make sure it's from a peer-reviewed journal, it's from a respected internationally published journal. Any evidence is based upon enough big enough population size to have enough power to demonstrate an effect. Just the general sorts of things on there that we'd want to. I know that personalised care, the evidence is often qualitative, and that's absolutely fine. The British Journal of General Practice and lots of other journals are very happy to publish qualitative research. So it doesn't have to be randomised controlled trials, but it has to be something that is recognised internationally as a sort of respected source of information on here. So there's a link to that on the application form as well. Intellectual property rights again. Just to make sure that actually anything that you're using, you're entitled to use, you're able to use. There are no copyright issues with it as well. So there's just another part of the application form. And we talked about conflict of interest again. This, I know I keep going on about this, but this is actually a really important part. Again, conflicts of interest. Again, we need to make sure people aren't seen to be promoting things for personal gain. Again, links to personal websites, personal publications, even things where there's even an indirect link. I took this from the NHS Managing Conflict of Interest thing. So for those that have not looked at conflict of interest before, it's a fairly standardized thing. So it should be available from whatever professional background you've got. But again, it's not just about this very, very obvious conflicts of interest. It's about the indirect ones again as well. It's got financial interests. You know, you've been paid by somebody to do something and promote their product. That's very obvious. Non-financial professional interests. Again, if there's a again, you gain that professional benefit or increase in standing by promoting a particular product, thing, resource, whatever it might be again as well. The other ones are a little bit vaguer, and you can run into problems with those. But certainly we get people who are married to people who sit on boards of charities, for example, and again, it's rare that in reality that people will take advantage of that. But the perception of a conflict of interest can be as harmful as an actual conflict of interest as well. So just anything like that needs to be declared. Often with transparency, it can be managed, or we may have to ask a different person to be the lead for the application. So there's often ways we can get around it, but we need to know about any conflicts of interest. So if in doubt, please declare it. I'm always slightly concerned when we see conflict of interest forms that are completely blank, and a quick internet search reveals people's LinkedIn history and all sorts of different things, and boards of directors they've sat on, and that always sets alarm bells ringing. So if there's been anything like that, please declare it, and use the framework on there, or a similar framework if you have one from your professional organisation. Quality assurance, the second bit that causes me not headaches, but always makes me look at this area as well. Quality assurance process, again, the bit in bold underneath the boxes to keep up with this. We need to make sure that people that have been selected to develop the content have the appropriate skills and experience to do so. What process they've been through, whether they've sat in the garden shed on their own, beavering away for 4 days producing it, or whether it's actually been part of a supportive peer process where you've got together as a group, looked at it, shared it, discussed it, talked about it, updated things accordingly. We'd much rather have the latter. If it is a one-person organisation, that's absolutely fine. But again, as before, we need to make sure that at least one other person has gone through the content to make sure they're happy with it. What we're also key on here, one thing we look for, and one thing that we often go back to applicants about, is the timescales involved. So we want to know that you're having, at the very least, an annual review of the content. Again, it depends what's actually involved in it. If it's a very stable bit of course that you're teaching, then in terms of the actual content itself, an annual review is fine. If it's a fast-moving, adapting, evolving, changing bit of the personalised care that you're looking at, then we might ask for 6-monthly or even quarterly reviews to be included on that. So again, please state that. Please state how often you formally sit and look at the content. We know that people often, when they get feedback, they will review the course and make changes both to the content and delivery after each course. And again, that's absolutely fine. But it's useful just to know that there's a slightly more formal process. It doesn't have to be a very in-depth thing, but at least to make sure that there's been at least one kind of meeting where people have sat down and looked at it and updated it to make sure everyone's happy with it. So please state that on this. Quite often we have send emails back saying, sorry, you've not said on here how often you review the material, and it just causes an extra unnecessary delay in the whole process. And again, 9.2 again is just further detail of things that you have produced that may be related to personalised care. It doesn't have to be. It's just for us to show that you have got a robust process for doing so. So again, it's just providing as much evidence as you can on here. It doesn't have to be lots. Again, paragraph or two is all we're after. We don't need pages and pages and pages of things, but we just need more than just a few words or a sentence about each aspect. We talked before about feedback, just to make sure that there's a robust way of providing feedback, and with an example of the feedback form, again, how often it's used. It's really useful for us actually to, particularly when it comes to the annual reviews, to have examples of changes that you've made. And it can be as simple as things like the room was too hot, room was too cold, and people couldn't learn from experience because they were worried about the environment they're in, or the sound didn't work on the internet. All the way through to things like the speaker mumbled, or the content wasn't available, or people, the presenter lost control during some of the small group work, for example, and plus any changes that you've made. So both to the content and the way it's delivered. So if you keep a record of the things that you've changed, again, it doesn't have to be detailed. We just need to know examples of things that you've changed, just again, provide evidence that this has happened. And again, the first application, if you've done anything in the past where that's happened. Again, put that down on the form. Again, just a few bullet points, a paragraph or two, that's all we're after from it as well. So again, evidence, evidence, evidence. I keep saying that again. So we're nearly done. Something like the process that goes on. So the applications that get submitted, the operational team make sure that all the paperwork's there, that the conflicts of interest are submitted, we haven't got anything missing. And at that point, it comes out to one of the clinical leads. At the moment, that's just me, but we may get another one or two to help. We'll go through it and make sure we're happy with the content and that we're happy for it to go out to an assessor, that there's nothing obvious from it. We will look for things like typos and spelling mistakes. So kind of, if you make sure that when you're submitting the material to us, it is the finalized version, because otherwise it just, at the very least, it causes irritation, and at worst, it just makes us doubt the quality of the material that's going to be delivered if it's full of grammatical errors and those sorts of things. Then it goes out to an assessor. So we've got a team of, we're going to have a team of about 30 assessors that are going to look through this. And spend probably half a day each on each application, going through it in much more detail than the clinical leads have had the time to do. They'll do this within 2 hours and produce a report and feed it back to us. And then the clinical lead will have a final look at it again, just to pick up on anything else, review any comments that the assessors have made, and then we provide feedback to you. The feedback, usually 9 times out of 10, once we get to this stage, this is absolutely fine. We think it's okay to meet the accreditation. However, there might be some areas that need updating. It may be broken web links. It might be spelling mistakes, those sorts of things. Occasionally, it's images that need changing or removing. We may also provide feedback about ways that the course potentially could be improved. Now, those changes wouldn't have to be made. The improvement changes wouldn't have to be made before the course is before it's accredited, but when it comes to reviewing it and updating it, these might be things that you might want to take into account for the next stage. Sometimes we come back to you and say, actually, I'm really sorry, we can't accredit it as it stands because we found these issues with it. And it may just be that there are a significant number of small errors within it, sort of material or factual errors. Sometimes it's because actually what's been given to us just doesn't match what's in the curriculum, or the methods used seem to be don't seem to match, or don't seem to be giving us enough evidence that what's going to be delivered will actually match what should be delivered as well. So in that case, we'll just say, I'm really sorry, we can't accredit it. Can you go back and address those issues and rewrite a particular section, or those sorts of things, before we can then have a look at it again and accredit it. So again, when it comes to giving us the material, really what we're after is as near to a final product as you've got, because that's what we're after. And if we get that, if everything's in order, we can go through the process very smoothly, get it signed off, and then you can start running the courses and receiving the funding. So that's the process. We have an email address that you can submit queries to. Again, the team are very happy to answer things that are not available. What we're trying to do on the application form is actually make it as clear as we can and try and guide people towards what the answers are. And I hope this webinar has given you some extra insight into that. So thank you very much for listening, and we look forward to seeing your applications.